Welcome back to the deep dive. Today we're focusing on a health challenge that's, well, it's far more disabling than I think most people realize. Migraine. It's not just a bad headache. Globally, it's ranked as the third most disabling disorder for people under 50. That's a huge burden. But there's this paradox right at the heart of it, and that's what we really want to unpack. When a migraine hits, the pain, the nausea, all of it, it just makes rest seem impossible.
Yeah.
And yet, if you're a longtime sufferer, you know that deep restorative sleep is often the only thing that actually breaks the cycle.
Exactly. It's a biological catch-22.
The very thing you need to heal is the one thing the condition stops you from getting.
And that push-pull is why this deep dive is so important. Our mission is to really analyze this complex link between how severe your migraine is and how well you sleep. We're drawing on a recent nationwide study and some extensive clinical guidance. We want to answer two key questions for you. First, does a worse migraine ruin your sleep, or is bad sleep the main trigger? And second, what can you actually do, tonight to start breaking that cycle?
Okay, so to guide this, our sources use two core tools. We should probably define those first.
Good idea.
First up is the Migraine Disability Assessment Scale, or MIDAS. Just think of it as a scorecard for how much migraine impacts your life. How many days of work or family life did you miss?
And then there's the Pittsburgh Sleep Quality Index, the PSQI. This is basically your sleep's report card. It looks at things like how long it takes you to fall asleep, how often you wake up, and how you feel the next day. A score over 5 means you've got poor sleep quality.
All right, let's get into the data then, starting with that hard evidence on correlation. So we looked at this recent comparative study from Saudi Arabia. It had almost 1,400 participants, all in 2023. And previous research always kind of suggested this was a two-way street, a bidirectional link.
Right, either one could cause the other. But this study really tried to nail down the effect of severity. And what they found was a clear, significant, positive correlation.
Meaning?
The worse the migraine severity, the poorer the sleep quality. It was statistically solid.
Okay, but the number they gave was R equals 0.18. For those of us not deep into stats, that doesn't sound massive.
That's a great point, and it's a fair one. A 0.18 correlation does mean there are lots of other factors, stress, genetics, you name it.
So why focus on it?
Because of the next step they took, the regression analysis. That's what suggests the direction. It showed that a higher MIDAS score, more disability from migraine, actually predicts a higher PSQI score. It predicts more difficulty sleeping. In fact, for every single point increase on that MIDAS score, which is roughly one extra day you've missed due to a migraine, your sleep difficulty score, the PSQI, it measurably increased by 0.179 points.
So the migraine itself is acting as a physical barrier to getting good rest.
That's what the data suggests. It's locking you into that cycle.
And we know this cycle is incredibly common. A PSQI score over 5 is the clinical line for poor sleep.
Right.
And one study just on students with migraine found that 82.5% of them hit that mark. That's just overwhelming.
It is. And even though this new data points one way, we have to acknowledge that clinically it feels absolutely bidirectional.
The other direction being poor sleep as a trigger.
Exactly. Too little sleep, or even, interestingly, too much sleep, is a classic, well-known trigger for an attack.
The sources quote a huge range for that trigger, from 61% to over 81% of patients. Why such a big range?
It's likely a mix of things. The data might be a bit noisy, but it really highlights that it's not just about the total hours you get.
It's the consistency.
Consistency is paramount. Any big deviation, like that weekend sleep in, can just destabilize the whole system for someone prone to migraine.
Okay, let's get into the wiring. How much of this is just built into our brains? Let's talk about the hypothalamus.
The hypothalamus is the key intersection point here. It's the master regulator.
For what? Sleep and?
For your sleep-wake cycle, for your circadian rhythms, but also for things like hunger and body temperature. And what's fascinating is that its activation is also thought to kick off those early migraine symptoms.
Prodrome, that yawning, the fatigue.
Exactly. Those warning signs that happen before the pain even starts. The fact that they share this one control center in the brain, well, it strongly suggests the two are fundamentally linked.
And the attacks themselves physically wake you up. Up to 2/3 of patients report being woken up by the pain.
Yes, often right out of the deepest stages of sleep, like REM or slow-wave sleep.
That's brutal.
It is. And there seem to be patterns. One source noted that waking up from a headache was significantly linked to having a family history of them.
So there's a genetic component to how stable your sleep is during an attack.
It seems that way. And when researchers dug into the type of sleep disruption, they found 3 specific things were most strongly linked to severe migraine.
What were they?
First, just difficulty falling asleep. Second, general sleep disturbance,
Mm-hmm.
waking up a lot. And third, how much that bad night's sleep messes up your next day.
So beyond just general insomnia, we have to talk about obstructive sleep apnea, OSA.
A huge one.
Yeah, because that's the one that leads to those awful morning headaches, right?
That's right, the fragmented sleep, the drops in oxygen. It's a perfect recipe for a morning headache that can easily escalate into a full migraine.
Now, if you're listening and you're wondering about this for yourself, there's a really simple screening tool. It's called the Stop EB Bang questionnaire.
A great tool. It's not for self-diagnosis, of course, but to spot risk factors to talk about with your doctor.
Right. So STOP-P stands for?
S is for loud snoring. T for feeling tired during the day. O for observed apnea. Has anyone seen you stop breathing in your sleep? And P is for high blood pressure.
And then bang.
B is for a BMI over 35. A for age over 50. N is for large neck circumference. And G is for male gender.
And if you score 5 or more, your risk is high.
Very high. And treating OSA can be life-changing. Using something like a PAPI machine can dramatically improve sleep, and we've seen it reduce migraine symptoms even in people who are resistant to other treatments.
We should probably also quickly mention a couple of other related conditions.
Yes, definitely. First, bruxism, or teeth grinding. It's very common in migraine patients, and that clenching might activate the trigeminal nerve, which could be a trigger.
And the other.
Restless leg syndrome, or RLS. Migraine patients are just significantly more likely to have it. They're all fellow travelers.
So, given all this biology, this vicious cycle, the big question is, what can we actually do? We need tools to break the loop.
And that's where we can get really practical. Let's pivot to the SEEDS mnemonic.
SEEDS. Okay, what does that stand for?
Sleep, exercise, eat, diary, and stress management. It's a framework that focuses entirely on things you can control.
Okay, let's break it down. S is for sleep hygiene. The key here, as you said, is consistency.
Same bedtime, same wake time, every single day, even weekends. If you need more rest, a short nap is better than messing with that core schedule.
And you have to protect your bed as a place for sleep. That means unplugging beforehand. No phones, no TV in bed.
Your brain needs to associate that space only with rest. The room should be dark, cool, and quiet.
There's one technique I've heard of called stimulus control. It sounds a bit weird.
It does, but it's very effective. If you can't fall asleep within, say, 20 or 30 minutes, you physically get out of bed.
And only go back when you feel sleepy again.
Exactly. It breaks that cycle of associating your bed with frustration and anxiety.
Okay, next up. E is for exercise.
Right. The recommendation is regular, moderate exercise, brisk walking, cycling, that kind of thing. 30 to 60 minutes, 3 to 5 times a week.
And the impact is pretty big, isn't it?
It's profound. Some studies suggest the benefit is equivalent to preventative medications like topiramate or amitriptyline. It's a powerful regulator for your nervous system.
But what if exercise is a trigger for you? That's a common complaint.
A very common one. The answer isn't to stop, it's to be strategic. You might need to use your as-needed medication before you exercise to slowly build up your brain's tolerance.
Got it. Next E is for eat. Nutrition.
And again, the theme is consistency. Eat regular meals. Avoid fasting or getting overly hungry because that can activate those same hypothalamic triggers we talked about.
And hydration, that seems so basic, but it's so important.
Crucial. And let's talk about caffeine. The goal is low and stable. Less than 200 milligrams a day consistently.
Because withdrawal can be a trigger.
A huge trigger.
Right.
But a stable, low dose can sometimes help your pain medications work better.
And finally, under E, we can't ignore weight management.
Right. Being overweight or underweight is linked to more frequent migraines.
And a higher risk of it becoming chronic. So achieving an optimal BMI is really a vital part of the strategy.
Okay, next is D for diary. This feels foundational.
It absolutely is. You have to track your attacks to identify your triggers. There is no one-size-fits-all migraine diet or lifestyle.
And the diary does something else, too. It helps prevent a really serious problem.
Medication overuse headache, MOH. This is where the treatments you take for the attacks actually start causing more headaches.
And there's a specific definition for that, isn't there? There is. Using simple painkillers like NSAIDs 15 or more days a month, or using triptans or opioids 10 or more days a month for over 3 months.
A simple diary can stop you from crossing that line. Even just a stoplight system, red for a bad day, yellow for a moderate, green for a good day.
Perfect. Simple and effective. And finally, the last S is for stress.
The one thing you can't avoid.
Exactly. So the focus has to be on coping skills, not avoidance.
Things like cognitive behavioral therapy or CBT.
CBT, relaxation training, mindfulness, the evidence is very strong. And we also see great results with biofeedback.
What's that exactly?
It teaches you to gain conscious control over things your body does involuntarily, like muscle tension, that can feed into the migraine cycle. It has grade A evidence for prevention.
So with seeds as our lifestyle foundation, what about other therapies we can add on?
There are a few well-researched supplements. First is riboflavin, or vitamin B2, 400 milligrams daily. It's thought to help with brain energy stores.
And that's considered.
Level B, probably effective. Same as magnesium, at 400 to 600 milligrams a day. It's just essential for nervous system function.
Then there's coenzyme Q10.
Oh, Q10, yeah. It's an antioxidant, helps cells produce energy. That one's level C, so possibly effective.
And just a quick note, for anyone pregnant or planning to be, riboflavin and magnesium are generally considered safe in lower doses, but CoQ10 is not recommended.
Good point. And beyond supplements, things like acupuncture have strong evidence, and so do some of the neuromodulation devices, like 10S units that use electrical pulses.
So when we pull this all together, the big takeaway is integration. You have to manage the lifestyle, the sleep, the stress, the diet, alongside the medical care.
You do. The data shows the severity of the attacks directly compromises your rest, and that creates this reinforcing loop that only a strategic, integrated approach can really break.
Which brings us back to that shared wiring in the brain.
It does. And it raises a really important question for you to think about. If migraine and sleep share these common pathways in places like the hypothalamus, could sleep be more than just a consequence or a cure? Could it be essential maintenance?
What do you mean by maintenance?
Well, recent neuroscience has identified something called the glymphatic system. Think of it as the brain's waste removal service. It's like a dishwasher for your brain that runs almost exclusively while you're in deep sleep.
Okay.
We know that the electrical event behind migraine cortical spreading depression actually impairs this cleaning system. So what would happen if we started targeting sleep, that natural cleaning cycle, as the primary intervention for preventing migraine, instead of just treating sleep problems as a symptom?
So viewing sleep not as recovery, but as the ultimate preventative cleanup.
Something for you to mull over.
That is a fascinating thought. For now, putting that SEEDS framework into action to gain control over these factors is absolutely the next step. Thank you for joining us for this deep dive.